This is healthisinternational.com, the health um, and evacuation presentation by Arno Chrispeels, International Health and Travel. He's located in California, but he has an extended portfolio of insurance insurances he's involved with. He's experienced in this. We don't need AI with Arno. He knows his stuff off the just as an amazing resource. Um, and trusted. And he's a cruiser and he's using insurance. And he started this because he realized that it was a big needed area for cruisers. Especially we've seen a couple of events this year that really made people be aware that evacuation insurance, if you're ill in a foreign country, can be very expensive. And he's nodding yes. Again, this is Seven Seas Cruising Association. This is the Health is International, their International Health and Travel um, Evacuation Insurance presentation. Um, SSCA is presenting this as a public service, and we do not, um, um, we have a disclaimer that you can find on our website, but this is for education and for um, um, uh,
Fun,
research
education,
and
and fun.
education and fun, mainly fun. And you're especially because Arno's sitting in Brunswick, Georgia. He will be traveling up the East Coast on his boat, coming up to the Chesapeake area and probably places north. I'm not sure what his itinerary does, but if you see him coming up through the ICW or maybe offshore, um, or he comes into an anchorage near you, you have an opportunity to say hi and touch bases with him. And at this point, it is 7 o'clock, and I would like to turn this over. I see a few more people coming in. Well, wait a minute. It'd be nice to see the magic 50 hit. And then I'll turn it over to Arno. You can ask in the chats. I'll be monitoring the chats and the questions and answers. Um, we have a question and answer at the end of the presentation. He will be giving approximately 30 to 40 minutes of presentation, and then he'd like to stop and answer chats off and on, so I will tell him um, along the way, or if you raise a hand, we can also see that. So at this, I'm going to turn this over to Arno and start the presentation now. Arno.
Hello, everyone. Thanks for coming. I'm excited to be here presenting to you. Um, I represent healthisinternational.com. It's my brokerage that I've built for the last 20 years, helping cruisers find short-term, long-term, and permanent insurance solutions for health and evacuation insurance as well. And next slide. I'm pretty good about helping people find insurance for your situation. Like I said, I've been doing this for 20 years. I have a background in education. I taught science for 31 years and started this on the side. And I'm known for my customer service. And when you call, you get me, not a bot, you don't have to press one for English or two for motorboats. You get me. And I have pretty wide ranging hours because I do work for myself. Um, and if you see that amazing smile on my face on that second picture, that's because that's a kingfish that I just caught last week on our boat. Next slide. We are brand new to cruising. Our boat is called Far Away. It is a Fontaine Pajot catamaran. And that's my wife Leah, who helps me out and is my rock. And there we are putting the new letters on the boat after our renaming ceremony. So I'm with you in terms of cruising, and what that means is I understand your needs and the difficulties. If you call me from Ascension Island, uh, in the middle of the night because you can't get clearance because you don't have proof of coverage, then I will help you find that. True story. Next. So there's three categories of insurance for cruisers and travelers, and it's really important to understand what these three categories are and how they're different. Um, so travel medical insurance is what I call short term. It's short term can be up to a year, but what's important is that this is travel insurance. This presumes that you have insurance back home that you could rely on. Um, and if something happened, if you got cancer, if you needed surgery, if you or sort of if you needed follow up care, they are they're confident that you have insurance back home, and so that they can send you home, and that's their goal, to repatriate you home so that you can get care with the insurance that you have. Now, many of these plans do pay primary, meaning they don't wait for your insurance to pay and then pay. They pay primary, but they're not designed for long-term use. I have many clients that use them successfully long-term, but it is important to understand what you have and what it can and can't do. The second category I call long-term or annually renewable. And this is the insurance that you're probably used to if you've had insurance from your employer or insurance from the marketplace, or if you live in a country that has health care that's provided for you. It would be similar to what has been provided for you for your entire life. Um, and then the last category is evacuation and extraction insurance. That would be evacuation to either the nearest best facility or all the way home, and or extraction from a remote situation where you need to be taken to a facility. And they need to send in a triage team and get you out of a situation to then get you somewhere where you can receive medical care. Next slide. Joan, next.
Yes,
Thank you.
I switch it. Yeah.
Uh, so travel medical insurance is great for short trips up to a year, will not give you any coverage in your home country. Though no matter where that is, Canada, Sweden, USA, it's not going to cover you in where you're from. Um, Typically used in combination with your insurance at home, and it's perfect coverage for accidents, falls, and new illnesses, car wrecks, all those kinds of things. Some plans that you may encounter out there when if you're shopping around on your own, they might exclude offshore sailing. Everything that I send to my sailors, of course, does not. And so that's an important thing to be aware of when you are looking around. One thing that's interesting about short-term medical insurance that, people always say, oh, well, I want to have this in case I have a heart attack. It often falls short for things like heart attacks or strokes because these are actually pre-existing conditions. They're a symptom of heart disease, for example. And so it's important to be aware that you can be exposed for something like that with travel medical insurance. They might cover the initial hospital visit, but then they may bulk at covering, surgery or something like that, like a bypass surgery. Next. Long-term insurance, annually renewable, covers you anywhere in the world. It includes coverage for accidents and illnesses, but also things for cancer, mental health. It covers all of you. So it's a super comprehensive. There are comprehensive plans that cover all of you. People often ask me about catastrophic insurance. Well, that would also be annually renewable long term, but with a high deductible. And then some of the plans, as we'll see, are very flexible and will allow you to say, oh, well, I only want hospitalization, which would be catastrophic. all of these plans have optional U.S. coverage. So if you want to, if you're a U.S. citizen and you want to spend time in the U.S., you can add up to 180 days of coverage. One plan will even allow you to do 270 days. If you are not a U.S. citizen, I don't typically recommend this as it can be very expensive. And there's other ways that we can work around for the time that you're going to spend in the U.S. I am all about you spending as little money on this as possible, and still having good coverage. I'm not out to sell you the most expensive thing out there that it's not going to leave any money for boat projects. Next.
Just a second here. We seem to have a
Problem.
there we go.
So all annually renewable plans, all of these plans, everything you're looking at so far generally excludes pre-existing conditions. And there are some exceptions, and we'll talk about that. But some plans are better at others. Some plans, the Blue Cross Blue Shield, and I should have fixed the name in my slide here. They've changed names. Formerly Geo Blue, now Blue Cross Blue Shield. It's always been owned by them. They will often cover your pre-existing conditions. They might include your favorite doctor on their Blue Card PPO. They are sort of the top shelf plan. One thing I will caution you about is if you buy a catastrophic plan and you say, oh, I only want this for the worst case scenarios, please don't get mad at me when you go and you get a checkup and it's not covered, because that's not a catastrophe. And I see that a lot. So I want to warn everybody, if you tell me you want a catastrophic plan, that's what I will offer you. And make sure you understand what you're getting. Next.
Next slide.
So let's take a look. So what I've done here is I've broken this down into some examples of people, of actual crew. These are all actual cruisers who've allowed me to use their likenesses and their names. And so I hope that you see yourself in one of these slides, but if not, that's okay. You just send me an email at the end and say, hey, this is me. Can I get quotes that are specific for me? But this will give you kind of an idea of what this stuff costs and what I would recommend in different scenarios. Next. So Tess and Alex and 3 kids are doing some seasonal cruising. And they are cruising the Caribbean, but they're returning every summer because the kids have a special summer camp they go to. They want to spend time with the grandparents, and they don't want to be down in the Caribbean during hurricane season. And they feel like they need a robust plan. They've got active kids, do a lot of sports and stuff. They wanted a robust plan that would cover them both in the U.S. and abroad. And so this is what my recommendations on the next slide here. So a full service long-term plan would be best for this family. They could save money with a higher deductible and possibly only inpatient coverage, but they would still be covered in case someone gets injured while in the U.S. And that's what they were really looking for. Next. And so here are the 3 recommendations I made. Geo Blue, or now Blue Cross Blue Shield. It's comprehensive. They're excellent on claims. They have inpatient, outpatient, and wellness. They have a lot of wellness benefits. You can go to the doctor up to 8 times with just a $35 copayment, or $10 if you're abroad. And that's what it would cost them for their entire family, not per person, for the entire family per month. Cigna is more flexible. And Cigna is my bestseller because it is more flexible. And you can see that the full plan is priced competitively to the Geo Blue. If you wanted that full plan, I would tell you to get the Blue Cross Blue Shield plan. But if you didn't, if you wanted to scale back a little and have more of a catastrophic plan, then Cigna has that option, and you can see that the price goes almost in half when you do that. The range you see is because of the deductible. The Cigna plans, the deductible goes from 0 to 10,000. On the Blue Cross Blue Shield, it's 0 to 5,000. And then the last choice would be IMG. I consider it my budget option. They're terrible for pre-existing conditions. They claims can be a little bit finicky, and they have some confusing policy wording, but they're definitely the cheapest. And for some people, it's better to have something than to have nothing. And in that case, I would say absolutely. And so they have 3 tiers: bronze, silver, and gold. And you can see the prices there. So the bronze plan is a hospitalization only. The silver plan includes a little bit of outpatient, and then the gold plan is a full service plan, just like the other 2 full service plans. Next. So here are 2 retirees, Alan and Carol. They're 65 and 69, and they are cruising long term. They may come back to the U.S. to see family. They have Medicare if they do. And if somebody got cancer or had a stroke or developed Parkinson's disease, they would come home. They've made that decision already that they'd want to be close to family if something like that happened. Next. So because they can come home for Medicare, I think that they should get a short-term travel policy and or just some evacuation insurance. Evacuation insurance wouldn't pay the bills somewhere else, but it would get them home to a hospital where they, close to family, to a hospital of their choice. Next. And so you can see right here that, wow, that's a lot cheaper. And that's because even though they're older than that other family, it's still significantly cheaper because it's short-term insurance and it's not covering those pre-existing conditions. It's not covering, a long-term like cancer treatment that would cost thousands and thousands of dollars. The one exception to the pre-existing condition rule is Blue Cross Blue Shield Platinum Plan. And that price is correct. I just updated all the prices today. The only catch is that you can only get 6 months of coverage. But this Blue Cross Blue, the one that's labeled Geo Blue Voyager, Blue Cross Blue Shield, is my absolute best-selling short-term plan, especially for the East Coast cruisers that are going down to the Bahamas, down to the Caribbean for 6 months and then coming home. It is unfortunately only available to U.S. citizens. So if you're not citizens or residents. So if you're not, then we have to go with a different option. My second favorite option is probably Globe Hopper. They have gone up a lot in price this year, nearly doubling over last year. But they are they are a good plan. They're based out of IMG. They're based out of IMG UK, not IMG USA. I see I have a mess up on my slide. This plan does not work with Medicare. They also have one that works with Medicare or Medigap, called Globe Hopper Senior. It's not as good as this one. So I would rather see my clients get this plan. But when cost is important, and it always is, the Globe Hopper Senior is also very good. And then also the most budget conscious one here, with it from a good company, in my opinion, is the World Trips Atlas, and gives adequate protection. It's the most affordable, flexible deductibles, so it's another good option. So you can see there's kind of a big spectrum of prices, and it's always important to read the fine print and look at the plans and understand what you're getting. Next slide, please. So I can't do a presentation without having some foreigners in here. So we have Dave and Cindy, who are cruising from Canada. A lot of my clients are Canadian. They tease me about the cost of our healthcare, and I accept their teasing. So these guys retired early, and they're cruising mostly full time, but they occasionally return to Canada. They have no prescription meds they take. They want to keep cruising as long as they can. They're very budget conscious. And next slide. So I recommended a scaled back catastrophic only plan with just inpatient, meaning just hospital care. Where they were going, outpatient care is cheap when abroad. They were heading down to Mexico first and then over to French Polynesia. So if you like especially as an American, you have to be comfortable with getting your care somewhere else. And I think as cruisers, a lot of times we forget that, hey, we're going out to other countries, and just as we're experimenting with the other foods, we might experiment with new doctors and different styles of medical care as well. And there are excellent doctors all over the world. Mexico is well known for excellent doctors. Panama, Colombia, a lot of nice cruising grounds have a lot of good doctors. So as long as you accept that, then we can definitely, get our care in other places and not worry about running back to our country of origin to get our health care. Next slide, please. So for them, a top shelf plan was something like Cigna. And you can see the cost of the full plan. The catastrophic plan is about half as much, a little less than half as much. I'm sorry, a little more than half as much. And that would cover hospitalization, emergency rooms, and cancer, even if that cancer was outpatient. Next best, I think, is a plan from a company called Expatriate that I really like. A little bit cheaper, a little bit richer benefits, actually. And they have an interesting way of doing their plans. So they do their underwriting at the time of claim instead of ahead of time. So Cigna does all their underwriting at the time of the claim, and most companies do. And Expatriate does not. They accept you right away, and their rule is we will cover any pre-existing conditions 2 years or more in the past if you have not sought care or take any medication for them. So if you have high blood pressure and you take a blood pressure medication, that is not covered on their plan. Whereas with Cigna, if you have high blood pressure and you take a medication, if they do not specifically exclude it, it is then covered. But let's say you had cancer 5 years ago. Cigna will tell you, no, thank you, we don't want you. Expatriate will say, oh, you're cancer free for the last 2 years. You don't have to get any checkups. You're not taking anything for it. There's no problem with you. Okay, you're covered. And so that's why they are a good they're a good sort of plan that I keep in my pocket. I like the company. They have good customer service, and I feel like they really fill an important niche. And then again, IMG is sort of the most budget alternative. Next slide. So Jim, Bob Marley, and Axel are still cruising. Axel's now 7, but I have their old ages in here. And they started off, they bought their boat in Trinidad, and then they worked their way up to the US. And when they got to the US, they got an ACA plan off the marketplace that was heavily subsidized, super cheap at $325 a month. I can't touch that with anything I offer. None of my plans are subsidized. So they had that, and I said, that is amazing. Keep that. Do not get rid of that. And let's look at other ways to fill in the international gap. So next slide. So for them, a long-term policy with U.S. coverage is important, but they have the ACA plan. And so what's the way of doing it? And so if you are in this situation, not everybody has a subsidized ACA plan. Some people have US insurance that they're paying a lot for. And so what I will do is a cost analysis of, hey, what does it cost to have your US plan with a short-term plan versus something that's just international? And so so we did that comparison for them. And on the next slide, we can see that. And I think I actually took out the comparison slide because their ACA plan was so cheap. There was nothing nothing that would compare. And so they went with a short-term plan for the times they were international. So they used their ACA plan when they were in the US, and then they used a short-term plan for when they were abroad. And you can see when you're young, it's pretty darn cheap. It's a great way to have international coverage. Also, these aren't for sailing necessarily. They're for any international trip. So I have some clients who are currently sailing over to France, and then they are trying to live there on a long-term visa. And so they're using the same plan. They're using one of these on their way over there, and then they're using one of these plans on their move to land too. So they're good for any kind of travel international, not just for cruising. Next. So I took my mother to Mexico. We all met in Loreto for Christmas one year. Just a few years ago. She's now older. And I learned a lot about evacuation, and it was very interesting. It was she had a blockage in her intestine that was life-threatening. And luckily, she had an absolutely amazing surgeon. The medical facility was sketchy, and it was really eye-opening for me to really see how this works. All this stuff works right in front of me. Next slide. So most of the plans that I recommend, all these travel medical plans, all the international plans, they will evacuate you to the nearest best facility for treatment. However, the decision whether to evacuate will be made by the insurer after consulting with the doctor. If you want more control over the decision, you need a standalone evacuation plan. When I called, and she had the Blue Cross Blue Shield plan, the short-term plan that I recommend. I 100% was expecting like a flying, Pegasus drawn chariot to come out of the sky and whisk her back to America because I called them and she needed evacuating. And that was not what happened. they actually said, the first question was, well, is she stable? And the doctor said no. And if you're not stable, they can't evacuate you. So it doesn't matter which plan you have. If you're not stable, you can't be evacuated. That was eye opening for me. And so, like I said, it's important to understand what your plan can and can't do for you. Next.
Well, I'm trying to do this. It seems to be being grouchy. There we go.
So I sell a variety of standalone evacuation plans. And what these are is they will fly you to any hospital you want. And the first one, MedJet, will accept you if you're US or Canadian, must be purchased before you leave the US. So if you're already out cruising, then next time you're home, if you want something like this, then next time you're home, you can buy it. The evacuation does not need to be medically necessary. In other words, you're in a hospital and the doctor says you need surgery. And you say, oh, I know a great orthopedist at Cedar Sinai. I think I'd like to have him do the operation. That's not it's not medically necessary that they evacuate you, but you would like someone else to do it. And so that's where a plan like MedJet or Travel Medevac TME will get you to a home hospital of choice. And a lot of my clients, especially in the Bahamas and the Caribbean, where medical care is sketchy at best, use these plans as a way of getting out and getting home. You do have to be stable, but provided that you're stable, you can get to your home hospital of choice. Global Rescue, they specialize in extraction and triage. They have telemed triage. They will send in a team. They'll use local teams to send you in. Like, let's say your boat has washed up on a reef and you have a medical emergency. They will contact local emergency people to get you and then cover that cost and then extract you to where you need to be. Um, and they will get you to the nearest best facility. If you can't be treated at the nearest best facility, then they will get you to the home hospital of choice. And so it is a distinction. I have had all the clients that I've had. Well, okay, I've had one client use this and need it, and they were mountain climbing, and they had a mountain sickness, an altitude sickness issue that was life threatening, and they were quickly evacuated and they were well covered. I have not actually had a sailor need this plan yet, maybe because sailors are more prudent than mountain climbers. And I think we're smarter too. Next.
Arno, I have a
Yeah.
question. I
Yeah.
don't see anything in chat. So if someone has a question, you can go into chat and ask, and we'll recognize it. But on Global Rescue, is that part of GEOS? Is that part of the emergency button when you push that you can sign up for if you push emergency SOS on your InReach or Iridium? Or is that
I
separate?
don't I don't know if it goes to them. They may also coordinate with those people. We have an InReach, and yeah, you pay by the month for that, and then that is also supposed to, and that's probably, I mean, um, from a economics perspective, having an InReach is probably a more economical solution than Global Rescue. They are they do security extraction, so if but that is another level. But if you wanted to go sail somewhere like um, Venezuela or Cuba or the Middle East, and things went south and you needed a security extraction, they do that. Um, they also are big on their telemed. So in terms of triaging over the phone and talking you through what to do in a situation. Um, they are well known for that as well. But yeah, if I call an in-reach emergency, what's going to happen? Um, the same thing. I don't know. That's a great question, Joan.
You have to actually sign up for stuff ahead of time, like everything.
You,
And I'm thinking that Global Rescue is a package that you can buy, but you could buy it through you too. I mean, I don't know what's most effective, but it is, it's
it's
1,500 or
not the
something.
same. Yeah, it's not the same um as just pushing the button on
Right,
your
right. There's an
thing.
additional thing you have to buy.
Yeah. Is MedJet coverage worldwide? Yes. Rates do not vary by MedJet and Travel
Oops.
Medevac are a lot like, you can leave it there. You can leave it there.
Okay.
Are a lot like AAA. So you get like 2 flights per year, depending on how old you are. If you're over 74, I think you get 1 flight per year. And um, and so it's just an annual policy that you have. It's not, the rates do not vary by geography. I think they do go up in certain age bands. Mostly, I believe at 74, they have like a gold member. And then the other thing, especially if um, Tom, especially if you're a part-time cruiser, if your trips are say 3 months or less or 6 months or less, the rates vary by how long you're away from home. And again, none of these plans um, are sailing specific. My parents traveled frequently as they got older. I mean, now not so much, but you only have to be like 100 miles from home or 150 miles from home. So they're good for ski trips. They're good for backpacking trips. They're good for all kinds of trips, not necessarily internationally. Um, if you live in Miami and you get a MedJet plan, it doesn't cover you in the Bahamas because you're not far enough away from home. Um, but obviously, if you live in Virginia, you are. So you have to be 150 miles from home. Um, I'll, I I will address Dan at the very end. I think Dan is great, and I think Dan has some pitfalls, and it's really important to understand it. Um, so I stabbed myself while spearfishing, and I got so lucky. Um, I I ended up being evacuated by helicopter. I will happily tell you the whole story over a cocktail sometime in some nice anchorage where we're swaying in the breeze. But my evacuation was free because I was picked up by a Cal Fire. I was on Catalina Island and I was picked up by a Cal Fire helicopter that was not in service. And so I did not have to, actually, I shouldn't say it's free, it's included in my taxes. So I did not have to pay extra for my evacuation from Catalina Island. You can see right there the average cost of an evacuation or a nurse escort um, from different places. And this is from 2022. I'm sure inflation has had its hand in this, and the prices have gone up significantly. Um, but that's a lot of money. We had a friend with a heart attack um, on the Big Island, and they had to be evacuated by helicopter to Oahu to the hospital, and it was $25,000, and their insurance covered none of it. So evacuations are expensive, and if you don't get insurance, at least get an evacuation plan that will cover that cost. Um, next slide. So another thing that I think insurance is really important for is when family or friends want to come and visit your boat. I can't believe how many people suddenly are our best friends now that we have a boat, and they're really excited to come visit. And we're excited that they're going to come visit. one of the things that I think I will ask them to do is I think I'll ask them to get some insurance. I think I'll insist on it. I don't want to be liable if something happens and then, oh, well, you didn't tell me that, get I could get hit in the head with a boom and fall overboard and crack my skull and break my leg. And, you didn't tell me that alcohol and boating were dangerous. So when we have friends come and visit, we're going to ask them to get some insurance. And I think it's a really good idea just in terms of CYA. Next. So, plans are short. They're only coming for a couple of weeks. We hope we were told don't put a nice mattress in the guest bedroom because people will stay too long. If you can show me the next slide, I've got some prices, and this is the same. And look, I quoted it per month, but you don't want friends staying that long, so we're talking $25, $25 to $50 a week for great insurance. CYA, make sure that they're covered, and I think that's a great idea. Something that I'm not talking about here because I'm gearing this towards cruisers is I also do trip insurance, trip cancellation insurance, which is super popular among people who do bareboat cruising. So if you're booking a bareboat, you can also reach out to me, and I help you see how to cover that in case something were to happen. Next slide. So if you buy a plan through me, it costs exactly the same as if you were going to directly to the company website and buying it. That's U.S. law. And the difference is you get me. And so if something doesn't work out, if they're fussy about a claim you have, then you have me at your back, ready to help. And my story that goes with this, I guess, is Jason and Nikki Wynn of Gone with the Winds are clients of mine, and they had an issue with a claim when they were in New Zealand, and I had to step in and help and get the claim paid. And it was an expensive claim, and they made a video about it. I'm in the video, and they talk about how basically that I had to be helpful, which is my job. And so the advantage to going with me is you get me. And also you get all my opinions about the different companies and things like that. Next. There is my website link. There is phone and WhatsApp and a toll-free number and my email. Email is honestly the best way. And you can just tell me about sort of what are the general travel plans, how old everyone is, birth dates are helpful, citizenship, and how to find you on no foreign land. And then I will send you back an email with prices or follow-up questions or whatever you need. And that's about it. What questions do you have? Oh yeah, Dan Boder. Joan, maybe we can come back to this slide at the end, but if you want to go to the next slide. I think the next one's, there we go. So as soon as I'm in the Bahamas and I'm diving and free diving, I will have Dan Boder. 100%. Absolutely a believer in it. I think it is probably the best insurance available for scuba divers and free divers. They're not a health insurance company, and their evacuation. So it's not. They do contract short-term travel medical to a company called CSA, which I'm not familiar with. I did look it up, but it's not one that you see. Dan Annual is not an annual plan. It's a multi-trip plan, and it's good for trips up to 45 days. Although some of their plans don't state a limit, but that's what they have told me when I called. Dan Evacuation is to the nearest best facility. It's not necessarily home. It's the same as all the other insurance plans I sell. Um, if you cannot be treated or you need follow-up care, Dan has taken people home. They don't always do it, but they will. If I believe if they can't get you treated where they are, they will get you. They will get you. I shouldn't say home. They'll get you to the U.S. Um, Dan's single trip, their single trip plan is not as robust as Atlas or IMG. And during COVID, they left everybody. They just dropped everybody. Um, at the very bottom, I have the cost comparison between and I literally just did this an hour ago. Um, the Dan short term plan, the IMG short term plan, and the Atlas short term plan. So you can say you can see you're paying almost $700 more um, for a plan for a 1 year coverage for $50,000 in coverage from a company that I haven't heard of, the CSA company. So, and then there's also on the Noon Site website for cruisers, the CEO of Dan has a lengthy letter that basically says, if you live on your boat, we're not repatriating you to the USA. We will repatriate you back to your boat. And that's from their CEO, not from me. I'm not making that up. The CEO said that. And I think they felt like they were being taken advantage of by cruisers. I'm not quite sure. And so I think it's important to understand what it is and what it can and can't do. Will I get it? Yes, I will get it for diving accidents because that's what it was designed for. Joan, if you want to put up that other slide.
Is this the one, Arno? Is this one?
Yeah, that one. Kara, did that answer your question? She might not
Tom
be able
Greaves
to.
says thank you, and John Schnellback, you answered his a question on Dan, and the MedJet coverage worldwide. Do the rates vary by geography? Um, I think I might have a question, and the question we do have a question.
I'm here for all of your questions.
Karen Fetter, Cara, hi Cara Fetters. Do you recommend Dan? Dan's diver network plan said you don't have to be diving for coverage. And
Yeah,
she says,
yeah, and
yes, thank you.
yes,
And you
okay.
answered that, I think. So um, I have a question, Arno. I don't know if you're aware, I had a catastrophic accident sailing in the Caribbean we were doing some hurricane support, and I was thrown across a boat about 12 foot. And I landed like seated, and I did flip forward, and I did like a seatbelt accident, and I broke burst fracture in the thoracic vertebrae, which is not good. Um,
No.
the medical care, the local hospital did an X-ray and said you're fine. I was not fine, and I realized then that it was medical care was a kind of a bit of a problem, but also I did not know how to get home, and it wasn't really clear. I wasn't feeling very good anyway. So I just braced myself up. Duct tape's wonderful. And we sailed home to Norfolk from Antigua. Um, if you need to you should have evacuation insurance. You should know and think ahead of time about what you will do in an accident like this. I was younger than I am now, and I was like, oh, we'll just figure out how to get home. It wasn't quite that simple. And we hadn't thought it through.
Young and young and foolish. I will say that I have had multiple calls post accident. Your exact situation. Okay, not your exact situation. Not even that bad, actually. But post accident, where people want to get insurance, and I think if a hurricane took out your boat and then you called and said you wanted to get insurance, I'm pretty sure they're not going to say yes. And if you crash your car and then you ask to get insurance, they're not going to say yes. And it's the same thing. You can't get insurance for something after the fact. You really need to kind of plan for this. And I had a client just the other day ask me, um, they they said, well, I want to do a review of my plan because I haven't used it yet and it's been a year. And I responded, have you used your hull insurance? It's been a year. And think about why you're buying insurance, and think about, like, okay, well, just because you didn't use, I mean, I would say congratulations, you did not need your insurance last year. That's not a reason to cancel it or to scale back. Maybe it's a reason to scale back, but it's definitely not a reason to cancel insurance just because you haven't used it yet. Um,
And we have an excellent question from Ned Cabot.
Healthinternational.com.
He's asking if we have Medicare and the usual supplement plans in the US, does that not cover me outside the US? If I paid out of pocket, would I be reimbursed? From personal experience, no, but maybe that's different for
Um,
you. And um, more broadly, I don't think I understand how international insurance works with existing US insurance. Very good question, Arno.
okay, so Ned, let me see if I can answer that. Um, most of these plans, um, most of these plans are um, they pay what's called primary. Um, so they pay primary. They will pay first, and so will you have to then submit a claim and get reimbursed from said insurance company? Like, um, let's say you had a Geo Blue Blue Cross Blue Shield plan, and they paid primary, and then, but that means that you paid at the hospital and then you submitted your claim and got reimbursed. And so you would be getting your reimbursement from the Blue Cross Blue Shield plan. If they decide that they want to, if they decide that they want to talk to Medicare and get reimbursement from Medicare, that's on them. That's not your responsibility. And so Medicare doesn't pay outside the US. It's absolutely impossible to get reimbursed from our government. Not that that should really surprise anybody. Um, some of the supplement plans do some coverage outside the US. I can't remember which letter it is. I knew it a while ago and now I've forgotten. There's a couple of supplements that do have um, that that do cover US, and then you would be getting reimbursed from that supplement company, not from Medicare. Medicare doesn't want to deal with anyone outside the US. Um, does that, Ned, does that help? Also, some companies have networks um, outside the US. So Blue Cross Blue Shield has a huge network outside the US. So does IMG. So do many of these companies. And if you go to one of their doctors that's outside the US, there's a very good chance that they will be able to pay directly, especially if it's something big. If it's something small, no. Um, but the bigger something is, the faster you get the insurance involved, the more likely they will um, uh, the the faster you get the insurance involved, the more likely they're going to issue what's called a guarantee of payment to the hospital and pay directly to the hospital. It's always up to the hospital or the doctor whether they get paid by your insurance company. It actually has nothing to do with the insurance company. So when we were in Mexico with my mom, they had no interest in getting paid by Blue Cross Blue Shield. They wanted us to pay them directly, and then we filed for the reimbursement. And it went really smoothly. It took about 6 weeks.
Arno, was there a
Yeah,
requirement to have a
yeah.
certain doctor certificate? I mean, some doctors aren't recognized
The
by
the
U.S. insurance.
when you get so when you get so some companies like Blue Cross Blue Shield even have apps that will help you find their doctors, which is really useful. And if you saw the prices, the Blue Cross Blue Shield short term plan is not more expensive than anyone else. They're just a lot better. Um, let me answer Ted's question really fast. Ted, I was comparing the Dan short-term insurance. Dan short-term insurance versus the other insurances that I have. You're correct. The Dan evacuation that gets you to the nearest best facility is $100 a year. It's not insurance though. It's just an evacuation plan like your AAA plan. So that's the prices I was showing you were of the Dan sponsored short-term insurance. What you have is the Dan, I'll call it AAA. So Dan AAA evacuation plan to the nearest best facility for diving or other accidents. And yes, it's a good deal. And yes, I will get it too. Alia, I don't know enough about what happens with, even though I have a Garmin InReach. Um, I don't know enough about what happens when I push that button to come and get me. Um, and I don't know how that works for mariners. There's no company that covers search and rescue. So if Garmin is covering search and rescue, that could, that could be really be a game changer, I think. Um, I will look into that, and my next seminar, I will have a slide on it.
I think there's some things you
Ned,
sign up for, Arno. You have to sign up
yeah, you have to sign
separate.
up for it, and I'll have to look into that a little bit. Ned, yeah, I do think supplementals that cover international are good. It depends how much time you're spending on your boat. Almost all of them have a limit. It's usually around 60 days. Some of them are 90 days. And so if you're spending more than 3 months on your boat abroad, that plan probably isn't going to help you out much. But you can maybe save money by using that plan for the first 90 days or 60 days and then picking up an insurance for the balance. And I have had clients do that multiple times. John asks about, do all the plans require you to pay for care up front? I'm going to say that 75% of the time, people are paying for care up front and getting reimbursed. I think that's just how it ends up working. And like I said, it comes down to the doctor and the hospital and where you are. If you're in Europe, no. If you're in the Med, chances are they will be like, oh, IMG, we know them. Blue Cross Blue Shield, we know them. Whereas if you're in Latin America, French Polynesia, somewhere else, that may not happen. Okay.
I think you've answered everything.
If
Um,
um, if you see Far Away in an anchorage, that's our boat. It's named that way for two reasons. We were super excited to go far away. And now I realize that all my money is going far away. So if you see us in the anchorage, wave, come say hi. Um, Here at Brunswick Landing Marina, somebody came up to me yesterday and said, "Oh, we've talked before." I had my name tag on, and there's not a lot of Arnos in the world. So if you see an Arno, it's probably me, and come up and say hi.
I'm going to suggest, Arno, you're coming up to the Bay. If you're here before the 8th of August or after the 18th of August, come up to the Bay. I will treat you to dinner. We will have a cocktail hour open, uh, no host cocktail hour, and I'll invite everybody that I have location information for or on the hook here to that so they can at least shake your hand and say hi. So,
I'll take you up on that offer, and we'll work on our timeline.
yeah,
Yeah, and I'll be at the boat show again this year. I was there the last 2 years. I'll be at the Annapolis Sailboat Show. So if you come by and say hi, I'd love to put some faces to some names.
Arno, I think
Thanks
you'll
a
be
lot
at
for
the
listening.
tent.
Yes, I have not looked at the new layout, but I think I'm by you again, so that's great.
So if SSCA will have a tent, probably tent M area, I think. Arno is probably going to be near us. Just stop in if I know, we'll know where Arno is, or if Arno knows where we are, and we'll just collaborate. We also will may do some um, get-togethers a little bit, lunches or something. Boat show's busy, but we can probably get together at the boat show too, Arno.
Sounds
And
great.
we have from Eva, thank you very much, very helpful information. Um, Eva, thank you for attending. In fact, everyone, thank you for attending. And Arno, do you have anything else, or are
Uh,
we?
send me an email. Don't wait till the last minute. From now till well, basically from the 1st of August till December is my super busy season. So don't if you're interested, you know, I would rather you have an email sitting in your inbox with a bunch of information, and then when you're ready to buy it, then you have all the prices and all the information you need, rather than waiting from the week that you're trying to cast off and things like that. So don't hesitate. It's quotes are always free, and I'm here to help. So reach out, and I will help you. And if you decide not to get insurance, I won't be offended, even if you ask me for quotes. So that's about it. Arno at healthisinternational.com.
Well, thank you very, very much, Arno. And I'll stop the recording.